Hello, my name is Cassie Adams, and this is my head to toe assessment for Advanced Health Assessment, University of Charleston, and Professor Skylar Bush. All right, hi buddy. My name is Cassie, and I'm going to be examining you today. Can you tell me why you came in today?
Allergies.
Allergies. Oh goodness. So what kind of symptoms are you having with your allergies?
Very itchy eyes. A lot of sneezing.
Okay.
Runny nose and some coughs.
Okay. When you cough, do you cough anything up?
Sometimes it'll be like a little bit of drainage.
So like you need to spit it out?
Yeah.
Okay. Are you having any body aches? Any jitters? How about a fever? Any chills?
I don't think so.
Okay. Is your throat sore?
No.
Have you had any trouble breathing? Do you ever feel like you're short of breath or can't catch your breath?
No.
Okay. And have you had any earache? Does your ear hurt?
No.
Okay. Any dizziness?
No.
Okay. Do you take anything for your allergies?
Yes, Allegra.
How often do you take your Allegra?
Morning and then night.
Okay, very good. Do you know how much you take?
No, I read the box.
Do you take any other medicines at home?
When I have other sickness, I take Tylenol.
Okay.
And I think Motrin.
Oh, all right, but nothing regularly every day.
Not really.
Okay. Do you have any other family members that have allergies?
My dad.
Your dad has allergies?
Yes.
Your mom have allergies?
Sometimes.
Okay. Do you live at home with your mom and your dad, or do you live with your mom?
I live with my mom and my dad.
Do you have any siblings?
Yes, I have a baby brother.
Little brother. Does he have allergies too?
I don't recall of.
Okay. All right, that's fine. Okay. And you go to school every day?
Yes, except for the weekends.
Oh, well, of course. Do you play any sports?
Basketball.
Oh, that's a good one. So, does anything that you do on your regular day, does it make your allergies worse?
Yes, going outside and playing, especially playing blacktop basketball and all that, yeah.
Okay, so that makes your allergies worse. What makes your allergies better? What helps with your symptoms?
Allegra and staying inside.
Okay, so that helps alleviate the itchy eyes and the sneezing. Okay. All right, so we're going to give you a checkout here. I'm going to check you out from head to toe, and we're going to see if anything else is happening, okay? All right, so I'm looking at your head right now, and everything looks normal. I don't see any asymmetries. Your eyes, your conjunctiva does look a little pink, and it does look a little watery, so I can see that your allergies are bothering you, okay? But I'm going to take another look at some other things. I'm going to look at your eyes first with my light here. So I just want you to look straight ahead, okay? Very good. All right, so your eyes are a little pink, a little red, but your pupils are good and reactive, okay? All right, I'm going to look in your ears real quick, okay? So you're going to feel me tug on your ear, and I'm going to insert this into your ear. Okay? Your ears look good. I don't see any fluid behind your ears. Your membrane is intact, and your cone of light is at 7 p.m. There's a little bit of earwax in there, though. Your ears get itchy?
When there's a lot of wax in there.
Yeah. All right, then we'll only do the same in this ear, okay? Okay, this membrane is intact as well, curly gray, and the cone of light is at 4 p.m. A little bit of wax in there as well, okay? I'm going to turn you around here. I want you to stick out your tongue. I want you to say, ah. Ah. Very good. Your throat looks good. It's pink, moist. I don't see any drainage. I don't see any blisters or curly drainage either. Your tonsils look good. So that is really good. You had any visual disturbances?
When I get up very early, sometimes I'll have a little noise.
Okay. Do you wear glasses?
When I'm using electronics, I'll wear blue light glasses.
That's good. So normally I would check your vision if I had a Snellen chart, but I don't have one. When was your last eye exam?
Probably, I think 2021 or 2022.
Okay. So we should probably get you set up with the eye doctor so we can get you another eye exam going on real quick, okay? All right. So if you were having any hearing problems, which I don't think you are because you seem to be hearing me pretty well, I would use a tuning fork and I would do a Wine or a Weber test. And I would strike my fork, hold it on your head, and have you tell me when you heard the sound stop. Or I would strike my fork and I would put it on this little bone here behind your ear and let you tell me when you heard the sound stop. But I don't have a real one, so we're playing with the dingle hopper here from The Little Mermaid, okay? Alright, so I'm going to check your neck now for any swollen lymph nodes, okay? So I'm going to turn you toward me. You let me know if anything is tender, okay?
Nothing too
Okay, and check your lymph nodes here on your cervical chain. I don't feel anything yet. That's really good. Okay, I'm going to check your trachea here. That feels good. And can you swallow for me? Very good. So your thyroid feels normal and I don't notice any tracheal deviation. I am going to look inside your nose though. I did forget to do that. Look up for me. Well, your nose is clear and you do have a little bit of running, watery, clear substance there. So a little bit of runny nose from your allergies. All right. So now we're going to move on and check your pulses and then we'll check your heart, okay? Can I have your arm? Thank you. Alright, you have a nice, strong, regular pulse. Very good. Let me check this on too. Very good. Let me see your feet. Very good. While checking your pulses, I also noticed that you don't have any swelling or edema, so that's really good too. So now I'm going to listen for your heart sounds, okay? You just breathe normal. Your heart sounds good. I don't notice any extra sounds. No murmurs, no clicks or gallops. Just the normal S1 and S2. I'm going to check your fingernails here real quick, okay? And what I'm checking is just your capillary refill. And we use this to see how well you're oxygenating if you're breathing. Also checks your circulation to make sure that your blood is returning normally. That's good. Just less than 3 seconds. Can I check your toes too? Very good. Good job. So you've got great capillary refill. So that's great. Now I just want you to kind of look ahead for me, and I'm just going to observe you breathing. You just breathe normally, okay? Pretend I'm not even here. Okay, your breathing is non-labored, which is really good. It doesn't mean like you're struggling to get any breath, so you're not short of breath, which is great. And it seems to be very symmetrical. I don't hear any auditory wheezing outside, and you're not using your accessory muscles, so that's really good. So I am going to kind of put my hands here on your back, and I want you to take in a really deep breath for me, okay? And let it out. Very good. So everything is even that way. I'm going to listen to your lungs real quick, okay? We're going to start in the front and then I'll move to the back. Deep breath. Okay. 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 All right, when you're doing it this time, I want you to say 99 every time I move my stethoscope, okay? All right.
99, 99, 99, 99, 99, 99.
Very good. Now I'm going to listen back here, okay? This time we're just going to breathe normal. Not big. Just breathe. Okay? Good. All right, this time now we're going to do the 99, okay? Read it.
99, 99, 99.
Very good. All right, so this time I'm going to have you say 99 again while I feel on your chest and then we'll feel on your back, okay? Ready?
99, 99, 99,
Okay.
99, 99.
Very good. All right, so now I'm going to check out your belly. Normally I would have you lay down, but I don't have a bed that lays down, so we're going to pretend you're laying down, okay? All right. Can you raise your shirt for me? Thank you. All right, so we're looking at your belly. Your belly looks good. I don't notice any abnormal masses, lumps, swelling. I don't see any striae, so that's really good too, okay? So I'm going to listen to your belly real quick if that's okay. Did you eat today?
Yes.
Have you had any belly pain anytime?
No.
Are you pooping okay?
Yes.
Okay. What about when you pee? Any pain when you pee?
Only when I'm dehydrated.
Okay. All right. You staying hydrated?
Yes.
All right. That sounds good. I'm going to push on your belly a little bit, okay? You let me know if anything hurts. First, we're going to do it real light, and then we're going to do a little deeper, okay? Anything hurt?
No.
Okay, we're going to go a little deeper. Anything tender?
No.
How about when I push over here? Do you have any pain over here on your left side? Or maybe your right side?
No.
What about when I let go?
No.
Okay. Take a deep breath for me. Any pain?
No.
Okay, so your appendix seems fine and your gallbladder seems fine. I'm just going to pound a little bit on your belly here, okay? Listen for some sounds. Oh, that sounds good. Check for your liver here. Your liver seems of a normal size there. We'll feel over here. Okay. We'll palpate to see if I can feel your liver. Liver is not palpable. Neither is your spleen, so that's good. I am going to listen again for your arteries to see if you have any grooves, okay? Over your big arteries that you've got in your belly. We'll feel for your femoral artery right here in the crease of your leg, okay? So that's good. I don't hear any bruise over your arteries, so that's really good. You can put your belly down now. I'm going to beat on your back a little bit here. Can you tell me if this is tender, okay? Does that hurt?
No.
Over here.
No.
All right. So I didn't notice any swelling in your belly either, so that's good. No, it's slidey. You don't have any tenderness here in your back, so that's good for your kidneys, okay? All right. So now I'm going to test a couple of your cranial nerves. We've already tested a few of them, but we're going to test a couple more, okay? I'm going to give you a couple scents, and I want you to close your eyes and tell me what you smell, okay? Here's the first one.
Orange.
Very good. Okay, we're going to do the next sip.
Cinnamon.
Very good. Alright, so we got those. We've already checked your pupils, so we know that those are doing good. We've already checked your cardinal vision. That was doing good. You followed my finger. Great. So what I'm going to do is I'm going to put my fingers here on your temporal muscle, your temporal masseter muscle, and I want you to grit your teeth. Very good. So that is good. I don't notice any clicks, so that means no TMJ. Very good. Next, I'm going to take a sharp object and a soft object, and I want you to close your eyes and I want you to tell me which one you feel, okay?
Sharp. Dull. Sharp. Sharp.
Very good. We'll go down your arm, okay?
Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull.
Is it tickled?
Dull. Sharp.
All right, you did really well. So now I'm going to ask you to shrug your shoulders for me. Very good. Put them down. All right, I want you to turn your head toward me while I push against, toward this hand while I push against. Okay, we'll go the other way. Very good. All right, so now I need you to raise your eyebrows for me. Smile. Stick out your tongue. And move it back and forth. Very good. Can I check your gag reflex or no?
I'm sure that's good.
Okay. Can I look in your mouth one more time?
Yes.
Okay. Alright, so we got good soft palate units, so that's good. So now I'm going to do the whisper test. I'm going to whisper a word behind you in each ear and you tell me what you hear, okay?
Blueberry. 7.
Good. Good.
Florida. Mickey Mouse.
Very good. Very good. So normally, if I had a tuning fork, I would also strike the fork and hold it and let you tell me when the vibration stops to feel the vibration. But I don't have that. So we are pretending. Next, I'm going to have you close your eyes. I'm going to put a couple items in your hand, and you tell me what they are. Okay? We're only going to do one hand at a time, though. So close your eyes.
Red.
Very good. Let me have the other hand.
4.
Very good. Alright, so now, normally I would check your reflexes, but I don't have a reflex hammer, so we're going to pretend, okay? First, let's start with your arms. We would check your bicep reflex by holding your arm out and striking your thumb. And we would check your tricep reflex by holding it like this and striking your tricep. And your brachial reflex the same way, but we would tap it here. Then we would do your patellar tendon reflex by striking right here and watching for the reaction. But I don't have we'll just do the one side, we'll just pretend. I would also check your straight leg reflex if you were laying down. I would hold your knee and your leg straight and lift it up and look for any tenderness or if your neck bent. Same thing with the carnates. I would check it as well. laying flat, I would lift your head up and see if you had any flexion in your hip. We'd also do the scapula, where you would push against the wall, and we would work through your scapula to hang out. But so far, everything seems to be in really good condition. I do think it's allergies that's bothering me. So we are going to continue your Allegra currently. 5 milliliters in the morning and 5 milliliters in the evening, okay?
Okay.
Then I want to see you back in about a week or two to see if it is feeling any better, okay? All right. Thank you so much for coming today. I appreciate you. I hope you feel better.
Alright,
Thanks, buddy.